Welcome to Musculoskeletal AnatomyX. I'm Trudy Van Houten. I've been teaching anatomy now for 30 years, and I'm really looking forward to working with you as you learn anatomy over the next couple of weeks with us. I thought we'd start by talking about the teaching principles that we use to design this course for you, and there are 4. The first principle is that even very complicated subjects can be distilled down to basic principles. And that will be the emphasis that we'll use in this course. We'll be concentrating on basic principles. You will learn details. There'll be interesting details, but the main emphasis will be on the basic principles. The second principle is that curiosity drives learning, or should drive learning. You're taking this course because you want to, because you'd like to learn more about the subject, and we'll want to harness that in helping you learn. The third principle is that affirmation sustains learning. And the fourth is that assessment can help refine learning. So let's talk a little bit more about what these things mean. So even though the human body has a lot of structures, it has a lot of detail, what we'll be concentrating on in this course are the basic principles that you'll actually remember. So the first of the 4 teaching principles is that even very complex subjects like anatomy can be broken down into simpler basic principles. And that's where we're going to concentrate our teaching. So there is quite a lot of detail, but we won't be working with that right away. The second principle is that curiosity drives learning. So we always learn much better when we're interested in what we're learning about, when it's something we've chosen to learn about, rather than having it assigned as a required course. And we also learn better when we have to figure something out. So the old model of taking a required course and sitting in the audience listening to somebody lecture while you passively absorb it or don't is a model that most institutions are not working for anymore. The 2 things we want to do then are intrigue you, get you interested in the case. These are real patients. They have real problems. Some may be life-changing. And also to recruit your curiosity, not only to intrigue you, but to help you figure out the case. Case-based learning is actually a really old method of teaching anatomy. So this is a page from the Edwin Smith Surgical Papyrus, which is at least 3,000 years old. And it is a model of case-based learning. So each case begins with a patient and then goes through the stages in the diagnosis and physical examination, which won't be all that different from what you'll be observing as you shadow the orthopedic surgeons in the AnatomyX clinic. So these will be mysteries, these will be puzzles for you to solve, and the more actively you work on solving the problems, the better you'll remember it. So we've taken a method that's got a track record of 3,000 years, and we're adapting it for you. Within the case-based learning framework, you will meet 5 patients, and the 5 patient cases are designed to build over the weeks you'll be taking this course. So for each of them, instead of trying to teach you all of anatomy didactically right away in a big session at the beginning of the course, it will unfold. So for each of the cases, you'll learn about different aspects of anatomy, different concentrations of anatomy, and we'll go through this in a logical fashion. So we'll be intriguing you with the 5 patient cases, we'll be counting on you to figure it out, and we'll be giving you a lot of help along the way, knowing if you understand it and what you need to refine. That would be the third principle, which is that confirmation sustains learning. So on the old teaching model again, most of the feedback that we got was criticism or number of points we took off on the arithmetic quiz, things that we all remember, and it's not a balanced kind of criticism. What you need to know as you're learning is not only what you're doing wrong, which is usually pretty easy to find out, but also what you're doing right. And so, and we won't let very much time go on in your learning sessions before we'll give you a chance to confirm that you know what you know, or to indicate a situation in which you might want to go back and review something that you've maybe missed or got a misconception about. So there'll be plenty of affirmation, there'll be plenty of confirmation. We want you to enjoy this. We want you to know when you got it right. We want you to have a feeling of achievement as you work hard to learn the anatomy in this course. The fourth principle is that assessment can refine learning. So we want you to know as you go along what you're getting right, but at times it's also very helpful to know what you haven't quite got right. And so the frequent assessment exercises that we'll be giving you will enable you to do both. We expect that you should get about 80% of the quiz questions right. If you're getting about 80% of them right, then you should feel like you can continue and learn the next stage. If you're not getting 80% right, then you might want to go back and pick up the things you missed. So let's look at your first quiz question. The question is, all of the following statements are MSK anatomy teaching principles except A, assessment refines learning, B, curiosity drives learning, C, assessment confirms learning, D, might makes right, and E, and even very complex subjects rest on simple basic principles.